This module has been designed in response to the quality payment scheme for community pharmacy introduced by the Department of Health. It breaks down the whole initiative into an easy-to-digest, actionable guide to help you maximize the benefits and payments from the scheme. The key feature of this guide is the supportive forum specific to this scheme, where you can ask questions, offer advice, and help fellow colleagues along the journey. As part of next year's Community Pharmacy Contractual Framework, the Department of Health have introduced a quality payment scheme where community pharmacy contractors have an opportunity to get paid if they meet certain gateway and quality criteria. The scheme is voluntary. Pharmacies do not have to take part in it. However, the PSNC have advised it's in the best interest of the pharmacy to meet as many of the quality criteria as possible and to maximise the available funding. Meeting these criteria is of course in the best interest to the profession as a whole and to the public. The funding has been set at £75 million, which has been taken out of the total fund for community pharmacy, and it means that there is a potential for each contractor to receive a payment of up to around £6,400. I'll explain how this figure has come about later on in the video. In order to qualify for payment, there are 4 gateway criteria that your pharmacy must meet. If they are met, then you're able to advance with meeting the quality criteria, which is how you get paid. No payment occurs at the gateway stage, and if you fail to meet just one of these criteria, then you'll not be eligible for payment. The gateway criteria are as follows. You must be providing either the Medicine Use Review or the New Medicine Service, or be registered to provide the NHS Urgent Medical Supply Advance Service. The information about your pharmacy on the NHS Choices website needs to be up to date with regards to your opening times, your facilities, and the services you provide. You need to have NHS Mail implemented and functional. And finally, you must demonstrate that you are using the electronic prescription service. Once you've passed the gateway criteria, you can begin to work on your quality criteria. Each criteria is designated a number of points, and every point is worth £64. There are a total of 100 points to be earned per pharmacy, therefore you have the potential to earn £6,400 from this initiative throughout the next financial year. When you've completed a criterion, you have to make a declaration to the NHS Business Service Authority on a web-based form. You'll be assessed for these criteria at 2 review points. The first review point is on the 28th of April, and the declaration form for this review will be open from the 10th of April to the 12th of May. The second review point will be on the 24th of November, where declaration submission opens from the 13th of November to the 8th of December. The 8 quality criteria for this initiative are as follows. A patient safety report needs to be shown at review point, which covers the analysis of incidents and incident patterns, evidence of sharing learning locally and nationally, and actions taken in response to national patient safety alerts. This is a patient safety criterion that can be claimed at 1 review point and is worth 20 points. At least 80% of the staff working on the day of the review must have achieved Level 2 safeguarding status for children and vulnerable adults in the last 2 years. Again, this is a patient safety criterion, can be claimed at both review points and is worth 10 points. The results of your CPPQ form needs to be publicly displayed on NHS Choices. For distance selling pharmacies, it needs to be shown on their website, and they must notify the NHS Choices service desk upon doing so. This is a patient experience criterion, can be claimed at 1 review point and is worth 5 points. You must show that you're a Level 1 healthy living pharmacy. This is a public health criterion, can be claimed at only 1 review point and is worth 20 points. Pharmacies must show that they are using and accessing summary care records showing evidence of increasing use at each review point. This is a digital criterion which can be claimed at both review points and is worth 10 points. The information on the NHS 111 directory of services needs to be up to date. Again, this is a digital criterion, can be claimed at both review points and is worth a total of 5 points. You need to show evidence that you have referred asthma patients for review if they've been dispensed a short-acting bronchodilator alone more than 6 times. This is a clinical effectiveness criterion, can be claimed at both review points and is worth 20 points. And finally, 80% of all staff on the day of the review who are in a patient-facing role needs to be a trained dementia friend. This is a workforce criterion, can be claimed at both review points and is worth 10 points. The PSNC have suggested a plan of getting things done in order of priority. In the body below this video, I've created 12 segments for each of those criteria. Now, what I've tried to do here is structure their plan in a more simplistic manner, almost gamifying it and adding a key element of interactivity. If you hover over the image of each criterion, you'll see its description as set out by the drug tariff, and if you click on it, it directs you to the PSNC module on how to complete it. I've indicated the points value of each of them underneath the image, and the most useful aspect of this guide is the ability to discuss each criterion with a community of people all working on the same initiative. If you have a question regarding a specific criterion, click on this blue link here and you're directed to its specific discussion thread on Facebook where you can ask your question in there. It may be that your query has already been answered, and you can check this by scrolling through the previous comments. The forum is here for your support, and it's also here for you to support your colleagues. Please share advice and help others along the road to completion. The forum is a closed group, meaning that you have to request access to join it, and can be done so by clicking on the button that says Join Now. The admins will then accept you into the group. Once you've completed a criterion, you can click this link, which will take you to Farmer Outcomes, where you'll find a completion form to mark it off. Above these moduli, you'll find a countdown timer for the closure of submissions at the first review point, which is at 11:59 PM on the 12th of May. The form will open on the 10th of April at 9 AM, and declarations can be made through this button here. If there are any updates to this scheme, then I'll be sure to update this guide in due course, but bookmark this page for your reference. Good luck with it all, and looking forward to helping you achieve success.